Hello everyone, it's Michael Phillip, your physical therapist who is here to talk with you today about spinal surgeries for the treatment of lower back pain. In another video, I discuss conservative treatment options. But if you have exhausted all those options and still have not found relief from your back pain, you and your doctor may now be discussing more invasive treatment options. If you're considering a surgical option, I would do your research and speak in depth with your doctor on the procedure and the outcomes first. You need to understand that every patient is different and thus every outcome is going to be different. So you need to understand the risks associated with the procedures. And as most doctors would agree, the stronger you go into surgery, the better your recovery. So if surgery is on the table, I would look into doing at least a month or so of physical therapy first to make sure your recovery is as quick and pain-free as possible. Now, on to those more invasive treatment options. The first one I want to talk about is minimally invasive, and most may not consider this a surgery, but I put it in this video because it is a more permanent and invasive procedure over a simple injection. It's called a rhizotomy. A rhizotomy is a neurosurgical procedure that selectively destroys problematic nerve roots as they exit the spinal cord. It's typically performed on an outpatient basis using a simple probe to apply radiofrequency waves to the impinged, pain-causing nerve root lying between your facet joint and the vertebral body in your spine. A rhizotomy injection is successful in providing lasting pain relief for about 50% of patients. The goal is to reduce pain so you may resume normal activities and begin a physical therapy program. And now, on to those more surgical options. First, you have your discectomy. This involves removal of the herniated portion of a disc to relieve irritation and inflammation on the nerve root. It's typically done with a small 2-inch incision in the lower back, and they use tools to remove the portion of the disc that's herniated. It's common to perform this surgery with a laminectomy and/or spinal fusion. Now, onto that laminectomy. This is performed by removing a portion of the bone in your spine, which will allow for decompression of the affected nerve root that is causing your pain and is most common in treating spinal stenosis. It's going to be the least invasive of the spinal surgeries, but may still require months of physical therapy afterwards. The success rate of a lumbar laminectomy to alleviate pain from spinal stenosis is generally favorable. Approximately 70 to 80% of patients will have significant improvement in their function or their ability to perform daily activities and a markedly reduced level of pain and discomfort associated with spinal stenosis. Now you have the lumbar fusions. Fusions require permanent removal of the disc that is herniated and fusing the spinal levels above and below this disc with a bone graft, metal screws, plates, or cages. Now this is a fairly routine procedure and can be very effective and quick at relieving severe back pain and/or symptoms that extend down your leg. However, studies have also shown that it can cause accelerated degeneration at the disc above and below that fused level. And the newest surgery is a disc replacement surgery. This is being used as an alternative to spinal fusion. Where the fusion permanently restricts the motion at the spinal level, the replacement would allow for normal or close to normal mobility by implanting a mechanical device that will replace the function of the disc. This therefore decreases the amount of stress and degeneration of the vertebrae and the disc above and below the surgical area. Since it is a newer procedure, I would seek consultation with a trained and experienced surgeon if you're considering this option. So there you have it. Those are the most common surgeries. But as always in medicine, new procedures and surgeries are being developed all the time. So I would talk with your surgeon about any surgery he or she is considering prior to going under the knife to make sure you understand what is being done and the risks associated with it. I hope you never need the options listed above, but if you do, I hope this video was able to provide you some basic information and make you feel better going into the surgery. Till next time.